Good morning, everyone, and welcome to our Osher Center Grand Rounds. We're really excited to have our keynote speaker here, and we'll just introduce him in just a moment. But before we get started, just wanted to introduce, my name is Darshan Mehta. I'm the Education Director for the Osher Center for Integrative Medicine here at Harvard Medical School and Brigham and Women's Hospital. And it's my honor to and true joy to welcome you to our monthly integrative Grand Round series that we hold on the first Tuesday of every month from 8 to 9 a.m. Just as a quick few highlights and to alert you, before I introduce today's speaker, our next talk will be in the new year. We're really excited to have Dr. Ben Kligler, who is the director for the Center for Patient Care Transformation at the Veterans Administration nationally, and we'll be talking about whole health in the VA, moving from what's the matter with you to what matters to you. So look forward to having you there. And then Tuesday, February 1st, we have Dr. Michael Spertus from Mount Auburn Hospital here, and we're presenting a clinical case entitled Quieting the Mind, Harnessing Integrated Medicine in Primary Care. So with that, we're really excited to, I'm really my honor and joy to introduce Dr. Adam Rindfleisch. Dr. Rindfleisch is the Vice Dean of Education at the new Whole Health School of Medicine and Health Sciences, which is being created in Bentonville, Arkansas. He has many accolades, but to note a few, as a Rhodes Scholar, he completed a Master's of Philosophy and Comparative Social Research at the University of Oxford, where he explored how complementary health has been integrated into healthcare systems of different countries. Prior to arriving at the Whole Health School of Medicine, Adam served as the medical director for the University of Wisconsin's Integrative Health program. His academic interests include clinician self-care, enhancing medical education, spirituality, medicine, and traditional healing approaches in mind-body medicine. And I've really had the joy of getting to know him over the past year, particularly in some of the work that we do nationally around complementary and integrative health and medicine. But most importantly, his work in medical education is really, in some ways, unrivaled to many places in the country. And so it's really a joy to have him here. And Adam will be speaking his talk entitled Building an Integrative Whole Health Medical School from the Ground Up, the Promises and Perils of Starting from Scratch. Adam, please take it away.
All right. Thank you very much, Darshan. And it's such a pleasure to be here with you all today. I'm really honored to have a chance to share about what we're up to here in Bentonville. And also just so delighted, I'll just say that recently I heard that University of Wisconsin is joining the Osher Collaborative, and that's just a delight in many ways as well. So I will go ahead and start sharing my video here and my screen in just a second, and we'll kind of make our way through. My hope is to really spend a lot of time in discussion here, because frankly, part of this, in addition to tell you what's going on, is a shameless attempt to get insight from all my colleagues around things you've learned over the years as educators, working with perhaps medical students and other learners in terms of how best to promote this perspective that I think we all are interested in promoting around integrative health, and then also just really see what comes up in terms of questions as well. So let me go ahead and share my screen here. That's always the moment of truth, right? I'm going to assume that we're good. As Darshan said, my talk title today is Building an Integrative / Whole Health Medical School from the Ground Up, and the Perils and Promises of Starting from Scratch. I don't have any disclosures to make, and here's kind of what I was hoping to do, which is start with a quick history of whole health. I know not necessarily everyone has seen what whole health is exactly. I'm really glad you'll be hearing from Dr. Kligler next month around this too, because it really did get its origins in the VA, and I'll talk about that a bit. Really want to make sure you have a sense of the definition of whole health and the different ways that's out there. Share some experiences so far. We've been at this for about a year now-ish. I joined the team in March of this year. So we're really, in some ways, the curriculum and many other aspects are still a twinkle in our eyes, as it were, but we're working furiously to make sure that all continues. And then we'll talk about a few resources along the way. And as I said, end with a discussion. But my question for you, and what I'd really like you to hold as I'm speaking here for the next few minutes, is in a perfect world, what would have optimized your training? You know, whatever that may be, what would have made your education the best it could be? What would have made your education conducive to the values and ideas that you entered the profession with, if that makes sense? So I just encourage you to take a little time with that, and we'll see how it goes. So off we go. So let's talk a little bit about, I want to give a three-part history, which really runs from the VA to the Whole Health Institute, which is a sister organization for us, to the medical school itself. I just want to make sure that everybody really knows that the whole health movement, as I call it, had its foundation in the VA. For the last 8 years, I had the pleasure of being a contractor within that to help create clinical courses within the VA. We had courses including whole health in your life, whole health in your practice, eating for whole health for mental health, whole health for pain, various things as evidence informed as we could make them, where we brought people together. And really the idea was to give people some foundations, and I'll talk about some of those in a bit, but also allow them to truly create grassroots efforts around what they wanted to do at various VA facilities. So as we went around the country talking at different VAs, just getting a chance to see truly what emerged in terms of ideas that people had for how to do this. And it was a pretty exciting thing because a lot of different pieces came up. And, I'm really hoping that as we do the work with the medical school, and especially as we're bringing more and more students in and getting their feedback over time, even before we open, I hope we have that feedback and that input, we can continue to shape and mold and make it an iterative process. I did want to bring your attention to the website for Whole Health, and just to note that there's an entire Whole Health library that's available. It's got something in the neighborhood of 160 different documents, tools for clinicians. If you look closely there, the second bar down as well, there's veteran resources, and there are about 50 or so different resources, specifically column patient handouts, column materials for patients in general that you might want to take a look at as you're delving into whole health. And they're very relevant to whatever title you want to use, whether you say integrative health, whole health, even other monikers there. But as I still remember when we were there at University of Wisconsin, we had a kind of a meeting to discuss what would we even call this. And it was interesting. Tracy Gaudet, who's the director of the Whole Health Institute now, but had previously done the role of executive director for the VA whole health work in the Office of Patient-Centered Care and Cultural Transformation. She was going around the room, and we were just trying to figure out what can we call this, recognizing that we didn't want to impinge on anyone's turf or encroach on anyone's turf, but we also didn't want to kind of lose the spirit of what we were trying to do. And a lot of different things went around, and finally someone mentioned whole health, just as something that could be broadly encompassing of all these different ideas. And that kind of stuck. So whole health it was, and whole health it continued to be. Now with the VA, there's been some really fascinating stuff coming out of that 8 years of work around education. And I'll say, last I heard, and I'm sure it's a lot higher now, over 350,000 people had received some kind of whole health education, which in the VA, given the numbers of staff and veterans and everyone, is still just a beginning, but it's a huge beginning. And when they looked at the Veterans Health and Life Survey and compared veterans in general to veterans who received care at 18 flagship sites that were offering whole health, they really did find some promising findings so far. And I'll share a few of those just really quickly. Whole health is popular. People resonate with it. It improved veteran satisfaction, decreased opioid use, which of course is incredibly important right now as we continue to work with the opioid epidemic. The pharmacy costs continue to go up for everyone over the years in VA, but markedly at a slower rate with veterans who've had whole health experiences. Similarly, employee satisfaction at the sites improved as well. Less burnout, less risk for burnout among employees. And while they're still gathering data on how often folks go to the ER or use procedures, the bottom line is that there are improvements in cost per veteran, and overall those improvements stay even after they've completed their formal whole health education. So in other words, whatever's going on with the shift in perspective that whole health promotes, it's staying even beyond the formal programming that they receive. Let me just show you that here. So this is while people were in the programs. You'll see this drop in monthly outpatient costs, right? Starting from the beginning and going down. Everybody's a little nervous. Why is it dipping back up? But then they continue to follow these folks, very large sample size overall in terms of how did the numbers change. And when they continued, these are the alumni. These are folks who aren't necessarily getting formal whole health programming, and even 29 months out, their cost per veteran continued to decline. And that's gotten people's attention. You know, how in the world is that going on, and how might that be replicated outside of the VA, right? And so that's been the work in progress. I always like to show this slide just because even with all the data at a large scale, you know, so much of it is how you touch individuals' lives, and that's so much about all of the work we do, right? And just bringing attention to that last one, from a 37-year-old veteran, I used to drive over the Mississippi River Bridge to the Jefferson Barracks VA, think about jumping off the bridge every time. Whole health systems helped me to explore my purpose, find ways to use nutrition to reduce my pain, and use iRest, a form of meditation, mind body practice, and Tai Chi to get moving again. And I drive over that bridge and I think about tomorrow, I have hope. And for me, that's really kind of the guiding light around why this work is done. It's for the individuals, and because if it makes one life better like that, then it's got incredible value. So how can we take that, and how can we broaden it out there? And that's really where the Whole Health Institute comes in. And so there's really the whole sense that okay, how do we do this beyond the VA, you know, with all that we've learned from that work. This is the building that's already had the ground broken for the Whole Health Institute. I love this angle because it looks like it's kind of a ship moving forward or something. Really nice architecture right near, I'll talk about Crystal Bridges, the large museum in the Bentonville area in just a second, but on the Crystal Bridges campus. And you know, one of the things that comes up when they talk about the Whole Health Institute is you can't have major breakthroughs without major breakdowns. It's been incredibly challenging for all of us, you know, with COVID and so on. But one thing that's been remarkable is the sense that as we've moved forward, there has been a real push to look at new ways to do this, and that's been coming just in terms of we've all heard it many times, the challenges to the United States healthcare system in terms of, you know, value for the cost and mortality rates in the US versus other countries, and so on and so forth. So what might be breaking down, I like to think of as a possibility for a breakthrough and for some opportunity as well. The whole health definition that the Institute uses, and I'll go into a little more detail with this, is that it empowers and equips people to take charge of their physical, mental, and spiritual health to live a full and meaningful life. So really giving, I think the keywords there are empowers and equip, and thinking about it in terms of the whole person. The mission then of the Whole Health Institute, which echoes the mission that I think is reflected in the medical school work ultimately, is that the mission is to make whole health available, this style of care, all these elements that we all promote in the integrative medicine, integrative health world, available to all people in all communities. So what are some elements? I'll talk about the circle of health in a bit. That's really kind of the sort of foundational piece that all of this work is anchored in, I think, and I think it explains it pretty well to folks. Meaning, aspiration, and purpose, MAP, are a big piece as well. That is, you know, really getting a sense of what matters most to a person, and then engaging them in their care by building care and care plans around that meaning. There's therapeutic presence, which I think we're all big proponents of. How can you offer the best care in every way? Patient-centered care, being very open, great communication, empathy, etc., compassion in care. Whole person care, recognizing that the physical aspects are just the tip of the iceberg, and that there are many other aspects that when we draw those in can have remarkable benefits. Moving down to that second row, recognizing that it doesn't exist in a vacuum. I think there's this mindset sometimes that even with integrative health, it's kind of one or maybe a few people having to do all the work. And the way I'll say it is that it takes a village. It takes an interprofessional team to do whole health. And I think even thinking beyond the idea that it's interprofessional medically can be really interesting. You know, what if we start thinking about how we can work with other colleagues It's certainly been fascinating as we've been working with the medical school work to kind of envision, okay, how do we work, for example, with schools of business or schools of other branches of the health science, or with nutrition, or with various elements of mental health, or even working, for example, with the arts and humanities, and I'll get into that too. Some of these other areas, and really drawing that together. Of course, thinking about the community, the structural determinants of health, as some people are saying, structural determinants of equity, really trying to make sure that this is as inclusive as possible. And reflects the needs of different communities, rather than being sort of, here's what it is, and we're going to sort of drop it on a neighborhood or a community or a group. Care of the caregiver is fundamental and an absolute part that will be woven into every aspect of the education at the school, even as we continue to explore various aspects of the curriculum. And then the whole idea ultimately is transforming the health system, right? How do we empower, equip, and treat everyone, but how do we do that in a way where the system is more balanced, more harmonious as well? So big intentions, and I think a lot of potential, and how that's done continues to be the subject of great exploration. So I'll just encourage you, as we're holding questions today, to just ask yourself, the springboard for a whole health experience, what really matters to you? And taking it even deeper, because the idea is to really kind of push this question whenever you're working with someone, if you can, what really, really matters? Why do you get up in the morning? Why are you showing up for your healthcare visits? Why is it important for you to be healthy? What really, really matters? And if you kind of start there, you're bringing this into your practice in an insightful and hopefully very useful way. So here's the circle of whole health. And I think sometimes it's easiest to kind of understand this whole framework by working from the inside out, kind of like ripples in a pool. So right there in the center is my purpose, right? The what really matters. Surrounding that is pause, notice, and choose. And that's simply, in the spirit of mindful awareness and mindfulness, really taking that moment to reflect, seeing what comes up, and then, as the circumstances allow or as preferred, deciding what to do with what you're aware of, and using that as the foundation, and helping yourself do that as a clinician or a leader or administrator or whatever role you might have, and also working with that with the patient, and hopefully conveying that as well into the organizational structures we're a part of. But really in a work with an individual, just getting them to pause and really ask, what does matter to me? What do I need in order to optimize my health or to maintain my health or whatnot? I love that most of the acreage in the circle is devoted to self-care. So as you look at the light green piece, there are 8 areas plus an other, so that you can add anything else that might come up. And a lot of those, I think, are things that we think of first, right? Healthy diet, you'll see right there at the top, moving my body, there's food and drink and so on, rest and recharge, getting good sleep, but then broadening that out and leaving space for other aspects of what we want to do with whole patient care or whole person care as well. So surroundings, skills and abilities, spirituality, which I tend to frame as related very closely to meaning and purpose, whatever that might reflect for an individual. And then power of the mind as well, of course, relationships and so on. So really trying to be broad-based, and just ideally, what I tried to do in my practice over the years at University of Wisconsin was really try to get a sense of one of those areas, when I was doing a wellness visit or a physical or whatever, or even during acute care, if time allowed, which often it could, to try to identify one of those and just see if we could move the dial just a little bit on one of those as they preferred. As you continue to move out, that darker green circle is the care team. Again, interprofessional, really recognizing that you need to think about that. One of the things I love about the VA model is that it centers around patient-aligned care teams, or PACTs, recognizing that in primary care and other areas, you're really working with an array of folks who are all responsible for making this happen, from the clinician who might see a person along the way, to the social worker, to the recreational therapist, to the nurse who's calling to check in, to the acupuncturist, to the cardiologist, et cetera, and really trying to make that as seamless as we can. And then last but not least, and I think encompassing this all, and I really do think of it as kind of holding the space for the entire circle, is the recognition that community is fundamental, that we, in the shelter of each other we live, as the Irish proverb goes. We need to be present for each other, and we need to honor the needs of communities as well, kind of that whole as above, so below, large scale, small scale work has to be done. And it can't be done just by trying to tell communities what they need or what this is, so much as sitting down and defining this together, healthcare teams and members of the community and so on. So really thinking about that, that's a very broad overview, but just recognizing that those are kind of the foundational elements of whole health, and what that looks like in practice varies among teams and practitioners a little bit, and also varies from patient visit to some degree. The transformed health system then honors that we're empowering, equipping, and treating. And that clinical care, you'll see, I call this the fidget spinner. Remember those fidget spinners that kids had for a while? This idea that there are multiple aspects of this. And the idea with this diagram, when they use it for the Whole Health Institute, is that empowering can happen not only by seeing a clinician. Clinical care is foundational, and you need your clinical care to be on board, but it's also about peers. It's about having health coaches or whole health coaches who can help out. It's about being able to get people empowered to know how to take care of those various aspects of self-care themselves. They're with themselves 24 hours a day, right? And how much time do we really have on average in a given year to work with individuals as a healthcare system relative to the amount of time that they are on their own doing this. And then the equipped, you'll see under there. And personally, I like to think of integrative health in its broadest sense as being very close to synonymous with whole health. In this case, integrative health is referring to this idea of bringing all these other areas and all this other expertise in as well to optimize how well we can equip people, so that, whether it's the various things that the VA covers now, like mindfulness courses or massage for pain or acupuncture, or even beyond that, how do we help folks build up skills? How do we help them receive care even beyond the standard clinical approaches that you might see? And Whole Health Institute also wanted to make you aware of their website. There are clinical series. You can sign up for these courses now. They're available nationally, some of them, and they continue to evolve. Folks are hard at work to continue to bring those forward online so that they're widely accessible. And there are different materials that you can go into and look at. So you can fill this in. So I want to learn about everything. You can choose different aspects of whole health or self-care and go farther with it all. And I just encourage you to play with that, because I think from an integrative health perspective, there's a lot of richness there that you can delve into. So again, just to give folks that, wholehealth.org is the site. And that brings us to the medical school. And as I say, a lot of this is a twinkle in our eye. Our name is pending. There's talk about making it a School of Medicine and the Healing Arts with some other name in front of it, because you can't really trademark the title whole health per se. But the logo is pending. They aren't fond of my stethoscope on the circle, but I do that just to kind of move things forward. I figure if I propose ugly enough colors for our school colors and ugly enough logos, eventually people are going to be so fed up we'll move along. And we are. There are focus groups that are assessing, different names and colors and things even as we speak. The website's a work in progress too. We're working with a contractor on getting that together, and it'll be appearing here in the next few weeks, hopefully, if all goes well. And a lot of hires are pending too. So, as I like to say, if you know folks who are interested in dean jobs or faculty jobs, and that includes working with you all, this is my shameless effort to get some faculty recruitment going too, just bringing you all in to share your expertise in integrative health and this work. Just know that that's coming as well. And just a little aside, we don't have a mascot yet, but wow, looking at mascot possibilities, there are a lot of interesting things out there these days. So we'll see where we land there too. So let's talk a little bit about the medical school. There's a lot we don't know, but there's also a lot we know. So, it was announced back in March, around the time I started with the school as Vice Dean for Education, that there was this intention to build this up. The Northwest Arkansas Council created a report, and basically it said, we need more physicians in the area. It's hard to get specialty care. This area is growing rapidly. That essentially we're we're in an area, Bentonville, Rogers, Springdale, Fayetteville, Bella Vista up north, where there's somewhere in the neighborhood of 350,000, 400,000 people, as I'm hearing at last count. And the expectation is within less than 10 years, that'll probably be 1 million people. It's growing incredibly rapidly. Walmart's bringing a lot of its central office action back here to the area. Lots of folks from all over the world coming in. So just very, very remarkable kind of setup there. And so we are planning to build it in Bentonville, Arkansas. The specific location still hasn't been announced. There are different sites being investigated, but from what I'm hearing, absolutely beautiful location and really conducive to medical education. The intention is to matriculate the first class to come in 2024. 48 students, that number might change a little bit as we look at capacity for clinical rotations. 4 years long. There are some programs out there that are going for 3 years now, but that's not the intent. While the intent is to begin with granting MD degrees, the idea is that this is ultimately going to be an interprofessional campus. And the idea is that we'll be doing training for a lot of different healthcare professions, which I'm really excited about. And what that looks like to have MD students and nursing students and social work students and all, mental health and so on, all integrated working together, for me is very exciting. And the opportunity to do this in a way, certainly we're going to make this as credible as possible, excellent medical education in the standard sense or whatever you'd like to say, as well as weaving in whole health throughout and just the prospects of what that might entail. So continuing to explore that as well. So as we move forward, then I have to say there's a little bit of this too. For me, when it was like, okay, we're going to start a medical school in a completely new way, essentially, and I'm going to get here into the perils in a second, but essentially we're sort of having to build a university system without, starting with a medical school, right? Because we're not affiliated with a particular organization or university. We're affiliated with kind of a nonprofit, the Whole Health School of Medicine, and we're, work closely with the Whole Health Institute, but we don't have an HMO or medical group or whatnot, and that can be both very freeing and tricky. So let's talk a little bit about the perils. As the path, there are a few dark clouds out there as we think about the path ahead, in addition to the rays of light, right? So the hope is that we're building bridges, right? This is the Van Nuys Bridge, I believe, in Vietnam, and this idea of creating something beautiful, something amazing, really connecting different professions, connecting the world through all this work that I think many of us in integrative health try to do as bridge builders, right? And the worry sometimes for me is that it might feel like at first we're really cobbling things together, right? Just trying to hold the space. And so trying to be as intentional as possible and trying to foresee as much as we can, recognizing that there will always be the unforeseen. That is certainly on, I think, everyone's mind here as we work with this. Another, it's hard to call it a peril, but a challenge is, Arkansas is an amazing place. I really fall in love with this area. There's this amazing, access to the Ozarks here. There are mountain biking trails everywhere, beautiful outdoors, 4 seasons, absolutely charming and lovely people. And Arkansas has got an interesting landscape going on. If you look at this, darker purple means, more challenges in terms of the poverty level, right? Northwest Arkansas tends to be quite well off. With the exception of some of those middle counties around Little Rock, if you move east and south, suddenly everything changes more and more. And as you get down to that Delta area, on the border with the state of Mississippi, there are a lot more challenges. And so part of this is we're charged, and the intent is to build a school that will support Arkansas in creating doctors and residents, even as we're working with trying to kind of bring about and foster a move nationally and even internationally toward this. So how do we honor the needs for Arkansas? How do we honor the needs for Northwest Arkansas as a region, but then beyond in the state? But then how do we honor this even beyond in the US and beyond more globally? And so that's something that's on everyone's mind, is how do we do this as we're recruiting and selecting students? How do we do this as we're thinking of pipelines? How do we honor diversity, even as Northwest Arkansas is not as diverse, say, as Southeast Arkansas in various regards, including, the level of rural versus urban, as well as ethnically, racially, and so on. So lots to think about. Part of the challenge too, as we're thinking about this and building relationships for clinical care, which, have been going along great, and, groups like the VA and various healthcare systems in the area, University of Arkansas have been lovely. And, when you look at the data, there are just not a lot of residency slots, and that makes it tricky to have the students experience residence as they're doing this. If we keep ourselves in the state with those experiences, we're trying to, look at all sorts of options. But the Arkansas is about just under 1% of the US population, and it doesn't have 1% of the residency spaces even. And so just trying to figure out how to make that work, how to honor the need for primary care, but also this, as I mentioned, intense need for care with specialty care as well. And so that is another thing that's on everyone's mind as we're building out curricula. Other potential obstacles, they are there. The lack of affiliation can be tricky in that, as we're building this, we've got to build up so many other pieces. There's not a financial aid office, there's not human resources, there's not student health. There's so much that is to be done, just in terms of things that you might take for granted if you're within the umbrella of a university system and trying to start a medical school. There are call them complementary approaches, providers, complementary integrative health providers around, but not a ton. And of course, that is part of this whole educational effort, is to honor that aspect. So as we're looking, there's some fabulous folks, and are there enough to make sure that we're training the students up and giving them that aspect of the experience? As I mentioned, there's a need for greater diversity, both in terms of faculty and really wanting to make sure we're honoring that among our students. There's the rapid regional growth I mentioned, and then there's this desire to remain credible, right? As we're doing all this work for accreditation, making sure that we're holding to what the students will need to pass step one of the boards and so on, but still maintain that integrity of having this be a whole health medical school as well. And so that's a dance that we're working with too, because we want our students to be able to get the residencies that they want to have. And speaking of that, and thinking about things in terms of, call it the shadow curriculum or hidden curriculum, making sure that there's enough faculty development and enough understanding of what whole health entails, that when students kind of leave the nest of the medical school in that first year or two, and then are doing even more with rotations, they'll start rotations right away, but then moving into their clinical time, is our faculty going to be able to be versed in terms of working from a whole health perspective with them, so it doesn't just suddenly seem like that's smoke and mirrors or something, right? So lots to think about, but certainly not overwhelming, just trying to be pragmatic about it all. And what I love is there are a lot of promises too. This is a view of just quintessential Arkansas bluff, the green, the water, love it. So the promises of all of this as well. And I think a lot of the folks on this call understand this. There's something incredibly freeing about doing this. And I hope that it resonates. To just put out a few last questions here for everyone to reflect on. I hope that as we do this, it will truly resonate with the underlying reasons why so many of us went into this work in the first place, work in healthcare, and also work for those on the call who are doing the integrative health side of things as well. Why did we do this in the first place? When we were young and perhaps a little more idealistic than it's easy to be when you're a little farther along in your career sometimes. What drew us to this work? And how might our work more fully align with that? How might our teaching more fully align with that? And how might a medical education in whatever health profession more fully align with that? So just sit with that as we're moving forward here. And what I love, there's a lot of opportunity. This is a chance to do things in a new way, to be innovative, also flexible. That whole not having an organization we're specifically linked to is very freeing, even as it has its challenges. And there's a real opportunity for novelty there. And so I just want to take this last few minutes while I'm talking to you before we open it up to just share a couple of ways where I see novelty coming on the horizon, and things continue to evolve day by day. It's amazing, if you ask me how the curriculum looked a month ago versus now in terms of what we're drafting out and so on. And mind you, right now, as of next week, we'll be 6 people strong with this. So still growing, doing a ton of recruiting right now in terms of building up our decanal, our deans group, vice deans, assistant deans, and so on. But work in progress is okay. So one of the things that I think is just a lovely aspect of this is that I'm not sure how many of you have had a chance to visit this before, but the Crystal Bridges Museum is really something remarkable that I frankly wasn't aware of until I started to explore moving to Bentonville as a possibility more. And the museum just had its 10th anniversary, Museum of American Art, and it's phenomenal. It's really a thing of beauty. And part of that is because it really is designed to make the artwork in the museum accessible to everyone. The kind of motto for the museum is art, nature, and architecture. And there's some really remarkable opportunities to see things. You know, some of the things that are in there, including Norman Rockwell's Rosie the Riveter and some, one of the Georgia O'Keeffe's signature close-ups of the flower, and just all these different pieces are there. And there's an expansion coming where they're going to add, I think, 100,000 more square feet to the museum. They hoped that they'd get a certain number of people, and they've exceeded that every year since they've existed. Just an unbelievable of people coming. And there's a beautiful opportunity here then, as we think about the medical school curriculum, to think, how do we bring the arts and the humanities into all of this? You know, how might we work with the museum to boost students' abilities to enhance observation, to work with picking up on visual skills, how to bring humanism and humanities into the work that we're doing. So having that woven in throughout is something that I'm very excited about. And that includes visual arts, but also then working with groups, including University of Arkansas and Fayetteville, around different aspects of the humanities and the fine arts. So doing a lot of play with that right now. The other thing that I'm incredibly excited about is this idea that the medical school will have an affiliated clinic. So there will be a whole health, call it a consultative clinic, that'll be right there. Opportunity for the students to learn, to do a clinical rotation in whole health and all that can entail, but also an opportunity for a learning lab. As I was saying, whole health is defined in many ways and oftentimes relies on the insights and needs of the particular groups that are creating it for their particular locations of patient populations and communities, and also for particular communities that are informing how this is done, right? And so thinking about all of that and really trying to bring to bear, how do we create a learning lab? How do we actually create a clinic that allows for investigation and research with all of this, even as we move forward? Has a lot of potential. So I think there's a lot to be said for this and exploring how this looks. The students will have, their OSCE exams, work with standardized patients. Here, Simulation Center will be right by it. We're working on building design right now, and as we're exploring that, there's really a chance to create something unique and hopefully something that can be very useful in general in terms of what we can discover around clinical practice and these models that we're all working with. Interprofessional collaboration, as I mentioned, this clinic won't just be come and talk to a physician. This clinic will be working with, I hope, nurses students, social work students, integrated mental health, and bringing in mental health students. It'll involve PT, OT, School of Business, helping people learn how to administer a clinic like this. Just the possibilities are endless. Telehealth, whole health coaching, working with peers so that someone moves through the process and then helps their fellow community members or their friends or their fellow patients or whatever move through the process as well. So lots of possibilities here, and the way I look at it, the sky's the limit. And then another one that I'm just very enamored with is, how do we truly honor care of the caregiver? As we all know, especially in the wake of COVID, there are a lot of challenges to self-care for all the folks who are offering care. And so how do we build that in, and how do we build in all these aspects of self-care directly into student experience, but not just students, faculty, staff, everyone who's involved with this endeavor? How do we make it normalized that self-care is a big piece of this? And so everyone has their own personal health plan that they've developed in terms of their goals around whole health and their own care, and identifying what really matters to them, reflecting, and so on. So lots of possibilities, lots of promise, and lots of work to be done still in terms of all of this. So I'm going to just say next steps are many. I would encourage folks, as you're sitting here reflecting today, please be in touch, share your ideas. This is a chance. I just as I say, it takes a village to do whole health. It takes a village to create education in this area. And the more we can get ideas, garner ideas from folks at a faculty level, an administrative level, a staff, whatever you want to say level, as well as a student, a learner level. Like, what do you as a prospective student want to see as part of your education? Recognizing that the group of learners we're going to have matriculate in 2024 is going to be a group of learners who's going through undergrad right now with, kind of in the shadow of COVID. And that really does influence everything in many ways. So my email is down there at the bottom of this slide. Please don't hesitate to reach out, Rindfleisch@wholehealthmed.org, and just share your ideas, share your interests, share your thoughts. I'm very curious. So on that note, I think it is time for questions and discussing. So I'm going to stop sharing. And I just want to thank you for your time and attention as we move to discussing a little more around what's coming up for you as I say all of this. So I'll turn it over to you again, Darshan.
Great. This is, such an exhilarating presentation. I can say, this obviously gets me really excited, and I can see we have a whole array of questions. So I'll start it off, and I'm gonna kind of combine a couple of questions together. The first one is just thinking about the building of the medical school itself from a curricular perspective. Obviously, there are different dimensions. There's the curriculum, there's actual physical space and all that, but just curriculum. I'm curious, when you've had your discussions with the LCME accreditation, I'm curious as to how they look at you. Do they sort of like, oh, we're excited, or they're like, is this like sort of what's going on here, or all of that? And then with that, how have you made a case to say we are just as similar to every other medical school, but we're also just as different? What makes the curriculum different, and what makes it look similar? So I'll pose those.
Yeah, great question. So I've been struck, as someone who's spent more of my time in residency and fellow education up to this point, just at how remarkably supportive. Don't get me wrong, it's a challenging and very elaborate process to get accreditation with the LCME, but also to see how that's really designed to support the students. And so taking it from the framework is how can we bring the best experience to the students, I find makes it a lot easier. And what I find is as we create the data collection instrument, the DCI, where you write this 400-page document that accounts for how will you do this, how will you do this, it really does help to contain all of this. What I'm pleasantly surprised about is, yes, there are a lot of things that we want to make sure we're doing, and certainly I'm spending a lot of time with the outline for step 1 of the USMLE and what we need to include for cardiology and for immunology and so on. But this recognition that they're really, much as there's this like space holding, there's a lot of room within that space to do things in innovative ways. And as you watch different medical schools that have been emerging recently, we've spent some time with Dell and at Kaiser Permanente looking, at schools like that, for example. And it's really impressive to me how much room there is for innovation. Yeah, you need to make sure that your students are treated well. You need to make sure that they have the exposure to the various clinic rotations, and whether it's explicit or not, there are rotations that they need to do. They all need their experiences in internal medicine and surgery and psychiatry and so on. But then there's also room. And so far, and we're still in the process of working towards submitting that DCI and really getting a feel. But it's been, for me, surprisingly supportive, and also a good process of, talk about pause, notice, and choose, just having an opportunity to think of things that you haven't thought of before. As far as the curriculum goes, I didn't want to get too far into this because, like I say, it's evolving every day, but they're really, I'll just say 6 threads that I think are weaving into it. And the idea with how we're designing this is to have those threads be part of the curriculum every step of the way. So even if you're emphasizing a particular area or organ system or something along the line, not having it become overly reductionistic, right? So what happens if you start with that case of the week that brings in a family from a particular community, and then you talk about it in terms of the humanities, right? The art of healing piece that I mentioned, ethics, and bringing in, so the various elements of how they navigate the system, health system science, as well as the clinical skills required, the science required, but then also things that are uniquely whole health, as well as kind of looking at that sort of bigger picture, too, of how this all fits into sort of the global sort of state of medicine as well. So, there's the LCME, and then there's also the regional accreditation, and then the Arkansas Department of Higher Education. So, the different hoops to jump through at these different levels. But yeah, so far so good. And I don't want to seem, overly idealistic or whatnot, but I'm also kind of inspired by the process versus feeling in any way beaten down by it, which I'm really happy about, because I'm not necessarily a person who jumps right into the bureaucracy of things easily. So,
okay. Well, leads to that, you kind of alluded to a second question, and that there have been a couple of in the Q&A questions of, how do I become faculty on your staff? But more thinking about in the broader sense of faculty development and how you recruit. Do you envision? I'm just giving an example, like. Yeah. Would you envision a professor of, say, chiropractic care being part of your anatomy course, for example, or radiology? And is that something? Is that even? I don't know. Is that even allowed? I mean, I'm just curious. Is that even possible?
Yeah, absolutely. I totally envision that. How do we bring this to bear? One aspect that I'm really hoping to do. I don't know how it was for other MDs, DOs on this call, but during my educational experience, I never, in 4 years, really had direct contact with nursing students or nurses, except, when you're on the floor and you're kind of being taught on the fly by them, which was incredible teaching, but there could be more. And so thinking about this idea of, I'm right now just calling them mini rotations, where your faculty can be for everyone who's potentially going to be on your team in the future, whether it's your chiropractor, your social worker, your chaplain, whomever might be there, and including folks who run different community groups or leaders in the community. Just spending some time with them, might not be days and days or even hours and hours, but getting a sense of what's out there. So there's that aspect of it. But to speak to your question, absolutely, being able to bring folks from a variety of different backgrounds in, and there is a certain degree of flexibility, making sure, of course, that they're learning from folks who are practicing medicine in the standard MD, DO kind of sense, as well as, looking at other ways this can be done. And then, welcoming as much inclusivity as possible with who the faculty are. And along those lines, drop me an email if folks are interested. I'm certainly at that place where I'm keeping track, and whether it's the whole, recruiting people into the community, or we need to build a cadre of visiting faculty, as it were, or folks who can kind of work with different elements. Absolutely, please send me your interest, because I guarantee you I'll be knocking at your door at some point.
Right. And so then it again making thinking about, I'm going to sort of segue into the next question, which I know is a theme you brought up in your talk, which is thinking about self-care, about sort of the learner care and self-care. And I'm going to kind of pose it in two different ways.
Absolutely.
One is, how do you incorporate, David Eisenberg raised a question here, thinking about how do you balance self-care versus sort of diagnosis treatment, like particularly let's just think about nutrition education, the self-care of the student, maybe, and learning, say, the teaching, the kitchen, in sort of having that approach, but how that really affects also the directly patient care. How, and maybe in other dimensions, not just nutrition, but we think about, stress management, we think about exercise, how do you envision those as curricular themes? And how have you thought of that so far?
Yeah, so a few things there. The initial design for the medical school building itself is to have areas that are kind of, physical health, mind-body health, spiritual, meaning and purpose-based health, and to have even the architecture reflect that, which I love. Speaking to the interest, and David, I hope you'll resonate with this idea that nutrition curriculum will be more foundational in this medical school than probably anything that's ever been out there. If I have my druthers, and if our team has their druthers, because it's one of the pillars for the whole institute, to sort of expand the possibilities for nutrition education and just what nutrition can bring to health. But then it's also, there's just so much more room to do. I don't know how it was for other folks, but we had a week or 2 weeks, I think, of pass-fail nutrition back 20 years ago for medical school, and most folks didn't show up, and most of it was just about, oh, this is the biochemistry of various vitamins, right? So lots of room to sort of enhance that and to do it with hands-on learning. And one of the things that we found in the VA work over the years was that the best way to kind of get buy-in or get people engaged with this, including the clinicians who we were hoping would use this model for veterans, was to have those transformational personal experiences yourself. So whether that means having the students start with an orientation experience where they're truly starting to experience these things and beyond, to the hope is, and the plan is at this point, that every student will have a whole health coach. So they'll have a personal coach who moves through their entire medical school experience with them, not as a faculty member, but as kind of a guide for them. Yeah, they'll learn about coaching, but that person doesn't grade them or report back to the faculty. They're just there for support. And then every aspect of kind of the whole health model and self-care that we're teaching, having the students reflect on that and explore how they incorporate it into their own experience as well. And the expectation that the faculty role models all of that, so that at any point, you can say, hey, faculty member, what are you up to? Hey, Dean, so-and-so, what are you up to as well? So, really creating that community and normalizing it, and even making it clear that it's okay to build self-care into your weekly schedule, and that it's not that extra thing you have to struggle for to find that time to do yoga or to run or to, make yourself a decent meal or whatever, but truly to have that integrated. So hope that gets to the gist of the question there.
Great. So I'm going to pivot just a bit in thinking about research, because one of the challenges that you described, and maybe it's a freedom and a challenge, is not having the formal, at least so far, the formal academic affiliation. That oftentimes will affect can affect, not often, but may affect how research is also conducted. How are you actually envisioning this? Because you don't necessarily have a built-in infrastructure. They have an academic institution that sort of creates or supports that. How do you think about research? Obviously, in education, there's tremendous research to be done, but right here as this thing, but maybe in other realms, there's clinical outcomes and other things as well.
Yeah, absolutely. And talking about that, and that is one of those branches of the curriculum that I was like, I know I've only mentioned 5. What am I leaving out? And it was like, oh, research. Yeah. So the research aspect, it's shaping out. And it was interesting. We've been working a lot, talking with, for example, the Walton School of Business, University of Arkansas, and then this amazing group, the Institute for Innovative and Integrated Research, which has these different funds coming in to create research in nutrition, molecular biology, material science, mind-body connection, some of these other areas. And it's just been fascinating to start exploring collaboration with these groups and thinking, how can we mobilize them for support as faculty, but also how can we have a lot of schools will require, and you're really supposed to have scholarly productivity or projects, right? Really help the students understand that. And what's been shaping up in terms of our curriculum is this idea of having the students do innovation projects. So over their 4 years, woven in throughout, having them get the mentorship and everything they need to do that. And it's funny, I had kind of a funny visceral reaction to this. Initially, a word that was being bandied about was entrepreneurship. I'm like, oh my word, are we gonna expect our students to create something that they can ultimately market or something? And then I realized, honestly, that the School of Business people kind of helped me reroute my thinking a little bit by framing it as, what if you think about things in terms of what's a need for healthcare, or what's a problem that needs to be solved, and how do you fill that need or solve that problem? And how about you shape those innovation projects around that? So whether it's designing a nonprofit model to bring whole health to a community that otherwise wouldn't have it, or it's, maybe a device or a product, but even more an educational tool, a curriculum, there are all sorts of possibilities out there. I don't think that as this is emerging, initially, we're going to be a place where there's bench research going on all the time, but really in terms of some of those aspects. And then also in terms of the clinical models, as you mentioned, and the possibilities with that integrated clinic and the research that can come out of something like that. And also out of working closely with partners that have been cultivated through the Whole Health Institute and the various organizations around the area. I think there's some potential, and it's branching out too. You know, there are groups from other universities that are wanting to collaborate and explore. One that I'm very excited about is there have been initial discussions with Epic, you know, the electronic medical records group, about how can we mobilize, you know, their Cosmos, their 200, almost it's 100 and some million bits of data about patients now, and how can we use that as a tool for teaching students about health information science and fostering research in that area too. So really trying to be sort of broad-based with that, partnering with other academic organizations. There's some cool stuff brewing with University of North Texas and Fort Worth, and Stanford's been reaching, you know, just different groups trying to figure out how can it look when partnerships are set up so that the whole health model is a piece of what's being investigated. So a lot to tease out still. I don't pretend that it's anywhere near fully formed, but it's starting to come together a little bit more day by day.
There's so many questions that I'm gonna apologize to to those that if we didn't get to all of them, but I did put Adam's email in there, so I'm
please, yeah.
I want to ask a question, really thinking about the sustainability and I mean, in some ways, I mean, and this may be intended to be a very blunt and difficult question, which is think about the financial viability. As you know, that student loan burden, I mean, financial burdens of medicals has skyrocketed. And I'm just curious, given that this is such a huge philanthropic investment, at least initially, the seed investment.
Yeah. Oh, yeah.
That, you know, how have you thought about the cost? What type of model are you thinking of following? Is it sort of the Mayo Clinic model, where there's a sort of big subsidy for students who are admitted into the Mayo Clinic, or is it a different model? And is there a sense of like, you know, again, because you've chosen a state like Arkansas, is there incentive for someone to stay and be retained and live and continue to work in Arkansas afterward, because you demonstrate a huge need for so just thinking about what is the model here? What are you hoping?
Yeah, well, not to sound like I'm waffling here, but to be determined still. There's a lot of discussion around that. You know, as the founder, Alice Walton, is exploring possibilities with that. And there's been a lot of talk about, you know, what tuition charge would there be, you know, how much would be scholarship based, especially early on, because in that first 4 years until your first class graduates, you're not fully accredited, and financial aid and relationships with programming is different, you know, until you've got that full accreditation in terms of what you can do. So there's a lot of discussion around that. To my knowledge, it hasn't completely landed yet, but you know, in terms of running the numbers, what I can say is that it's looking like tuition as it exists, or as it will exist, will be, you know, very, you know, how can you put it, reasonable, you know, and you know, that there will be a lot of care given to how do you make it work to support the community and so on. So whether you think of it as kind of the equivalent of loan forgiveness or whatnot, absolutely, you know, there's a lot of flexibility that comes with that unaffiliated status in that regard, because you can kind of create it as you wish in that situation. But the thing is, it's still being created. So I'll hopefully, you know, in another few months, we'll have a little more detail around that. But consultants are running the numbers for us and, you know, trying to figure that all out. So I'm optimistic it's going to be a pretty cool opportunity for students, however it plays out.
I just want to think, again, this discussion could go on for hours. But it was so exciting. You know, we're rarely in a place where we get to see, especially in our integrative health and medicine community, where we can see this like being built from the ground up, and you to be at the helm of this, and for us to be able to check in with you from time to time is truly a gift and a privilege. And so hoping that we'll have you be able to report back as
Absolutely.
you, and obviously we send our best wishes for this amazing journey that you've set forth. So I again, Adam, just from our team here and all of us in our community, you know, really thank you for this spectacular presentation. And this is a revolutionary time. And we're really proud to be associating with you doing this. So
thank you.
So thank you to everyone. Thank you again for just a robust, and again, my apologies for not being able to get to all the Q&A, but I did take the liberty of putting Adam's email in there because he had, so feel free to reach out to Adam directly if you have other thoughts. And again, please join us next month in the new year with Dr. Ben Quigler, which is an extension of this discussion, as many of you heard. I'm thinking about the whole health initiative in the VA. And wishing for those of you who celebrate the holidays a wonderful, safe holiday season, and look forward to, again, seeing you in the new year. Best wishes to everyone. Thank you, and we look forward to next time.
Thank you. Bye-bye.